First of all, thank you to everyone this evening for joining us on this Veterans Tele-Town Hall. I want to personally thank Dr. Stephen Braverman, Director of the VA Greater Los Angeles Healthcare System, for participating this evening. Also, thank you to Dr. Matthew Gitt, Chief of Infection Disease, and Dr. Neil Page, Executive Director of Community Care and Clinic at the VA, and all the other VA staff that are on the line as a resource tonight. A few general housekeeping items. After I open it up and make some remarks, I will invite Dr. Braverman, Dr. Gitt, and Dr. Page to provide some opening remarks. When our VA representatives have concluded, I will ask our esteemed panel the questions the audience submitted in advance. If you didn't get a chance to submit your question, the good news is that there's still time to submit your question by using the form at the top of my Facebook page, facebook.com/Rep Salud Carbajal. We will do our very best to get through as many questions as possible, but in the event that we are unable to get to your question tonight, my office will follow up directly with you. Now to begin. I don't have to tell you that these are unprecedented times. With the recent turmoil and racial tensions resulting from the tragic killing of George Floyd to the COVID-19 pandemic crisis. As such, the House of Representatives has recognized these challenges, and I'm proud to be supporting or have already supported a number of legislative solutions to date. As it relates to COVID-19, this includes 5 bipartisan economic relief packages that support our essential workers, including our healthcare providers, small businesses, agriculture, and our veterans. These packages include the Coronavirus Supplemental Appropriations Package that passed Congress and was signed by the President on March 4th, the Families First Coronavirus Response Act, which passed on March 14th, the $2.2 trillion CARES Act, which passed the House on March 25th, the $484 billion Interim Paycheck Protection Program and Healthcare Enhancement Act, which passed April 23rd, and the $3.5 trillion HEROES Act, which passed the House on May 15th and is currently awaiting consideration in the Senate. In addition, the Paycheck Protection Program Flexibility Act was also recently passed on May 28th and provides more support to small businesses by increasing flexibility to the PPP program. The Bipartisan CARES Act, which we passed on March 27th and that I mentioned earlier, established the SBA, PPP, and EIDL loan programs for small businesses and nonprofits. Stimulus checks provided to eligible individuals and expanded unemployment insurance benefits. It provides emergency appropriations for healthcare systems with over $64 million going directly to healthcare providers on the Central Coast. The CARES Act also included nearly $20 billion for the VA to fund COVID-19 related costs, including equipment, tests, and additional services and care for veterans. And CARES enhanced the capability for the expansion of telehealth visits, also known as telemedicine. The HEROES Act, which passed the House and is currently delayed in the Senate, and that I hope is able to move forward sooner rather than later, provides a 25% increase in aid and attendance for disabled veterans during the COVID-19 emergency to assist with daily activities and personal protective equipment. It also ensures that there are no co-pays for COVID-19 preventative services at VA facilities and provides grants per diem for children of homeless veterans. It also streamlines payments for emergency care claims to community providers, and it modernizes the HUD-VASH voucher program by allowing the processing of applications electronically and waiving in-person inspections. It also suspends VA debt collection activities during COVID-19 and extends deadlines to file claims and appeals for VA benefits to 90 days after the national emergency ends. It also eliminates cost sharing for veterans seeking COVID-19 VA care and permits National Guard and Reserve members to obtain care at VA facilities if deployed longer than 14 days in support of COVID-19 functions. That's just a brief update on the federal response to COVID-19 to date, especially as it relates to veterans. With that, I would now like to welcome Dr. Braverman, Director of the Great Los Angeles Healthcare System, to provide a general update and a few remarks. Dr. Braverman?
Hi, good evening, everyone. And Congressman Carbajal, thanks for inviting us to participate in the town hall here. I have with me a variety of folks, both on their own separate lines in a few cases and here in the room together, so we can help answer any questions that your team and the veterans in your area may come up with as we move forward. I have Dr. Stephen Simon, who's our Chief of Staff, Ms. Prachi Asher, who is our Associate Director for Resources, Dr. Neil Page, who is our Acting Executive Director for our GLA Ambulatory Care Services, Mr. Mac McHenrick, who is the Executive Director of our Community Engagement and Reintegration Services, the homeless programs, as well as our Master Plan, Mr. Steve Rue, who is our Chief of Communications, Dr. Ashna Basu, who is our Chief of the Community Care Programs that we have, and Dr. Matt Getz, who is our Infectious Disease Expert Extraordinaire, to be able to talk a little bit about the COVID stuff. Just want to open up by saying a couple of things. Throughout these challenging times, it's been our effort to continue to be able to provide care for our veterans across our entire catchment area while ensuring that we have the capability to take care of a surge of patients because of COVID, but also doing it safely both for our staff and our veterans, and try to provide an environment in which coming to the hospital and clinics doesn't increase the risk of getting disease, while also at the same time increasing our capability to do virtual care, to be able to see people in their own homes so that that risk doesn't apply to them. We've also worked with community nursing homes to minimize the impact of COVID in their populations, to include doing things like building our own COVID recovery unit in our nursing homes. So any nursing home positive veteran or COVID positive veteran in the entire community can come and safely be a resident in our areas while they recover from the virus. We've also built innovative homeless programs that are available for everybody across our catchment area to protect those vulnerable populations that we have here. I'll kind of stop there with my comments and want to turn it over to Dr. Getz so he can talk about briefly, the impact of COVID on our community. I am concerned with one thing as we move forward. Our plan is to re-expand the services that we have and that we decreased in regards to face-to-face visits, along with the expansion of retail and restaurants and other services in the general community. However, we're going to closely monitor the effect of an increase in large group gatherings and be prepared for any potential new surge in COVID illness across our entire catchment area. So with that, I'll turn it over to Dr. Getz.
Thank you, Diane.
All right. So thank you, Dr. Braverman, and I'm going to try to provide an overview of what many of us know, but try to put it in context, the impact of COVID-19 worldwide, and then how it drills down to the impact on our local communities. So, as no doubt all of you are aware, we now have millions of cases of COVID-19 around the world. As of yesterday, the World Health Organization estimated there were 6.9 million people have been infected around the world, with over 400,000 deaths. And if one looks where the disease is most active around the world, it was initially, of course, most active in China, and then most active in Western Europe, where Italy in particular had horrible problems. But now if we look at where the disease is most present, it's in the Americas. The United States and Brazil in particular has come up as a country that's had a tremendous impact by COVID-19. If we look at the United States as a whole, as of yesterday, the CDC reported 1.9 million cases of COVID-19 in the United States. And there are over 110,000 deaths that have come to the Centers for Disease Control's attention. If one looks at the shape of the epidemic, we are somewhat below the peak of daily cases that was being reported in April. In April, there were over 30,000 cases per week being reported to the CDC of COVID-19. Now that has decreased. We're down at about 20,000 cases per day. But if we look at the trends over the last 2 weeks or so, there's been no decrease over that period of time. On average, the number of cases is remaining the same. The epidemic has become a lot less hot in some places in the United States, particularly if you look at the northeastern areas of the United States, the New York metropolitan area in particular, which had a terrible surge of COVID-19 cases in early April. Their case rates have gone down dramatically. But if we look at the country as a whole, there are some spots that are hot and some spots that are cold. And, well, California varies as well, with some spots in Northern California being cool, with the number of cases decreasing, and other areas such as most of Southern California seeing increases steadily of the number of cases of COVID-19. If you look at the state of California as a whole, the state of California is up to 131,000 cases that have been reported, and with about 4,600 people having passed away due to the consequences of COVID-19. The number of daily cases being reported in California is now approaching an average of about 3,000 cases per day. And if one looks at the number of cases that are being reported in the state, that number is increasing, not decreasing. Some of that is certainly due to the fact that California has offered a lot of testing and the amount of testing has increased. But whereas in New York City, the number of cases, despite their testing, has gone down, in California, our number of cases has continued to increase. If one looks at the regions in California which are driving this, one sees that the hottest area of the state is Imperial County, but other areas that are seeing increases include Santa Barbara County and Los Angeles County. So we have reasons to be concerned in our communities. Within the VA, there have been over 16,000 cases of COVID-19 diagnosed, and approximately 1,350 people have passed away. At GLA, I'm counting our outpatients and inpatients, and many people have been diagnosed and have been managed at home and done quite well that way. We've had a total of 138 cases that have come to our attention through our diagnoses and by notifications by community care. Sadly, 8 of our veterans have passed away. Looking at Los Angeles County as a whole, we see that there are about 66,000 cases there. Now, Los Angeles has certainly been affected more than other counties. But if we look at the rates of disease in other counties, we see that whereas Los Angeles, about 600 cases per 100,000 individuals, Santa Barbara has added, for example, about 400 cases, about half as many. So we're continuing to see cases. We look at the rates of disease. The decreases are not being seen as much in Southern California as we would like. And I'll mention that last week, the testing done by Los Angeles County showed that there was an increase in the percentage of people who tested who had positive results. So as we have great need to open up society to healthcare, we know that many people are suffering. So as we re-expand our services, we need to keep our eye on the ball. There's a lot more that I could say about COVID-19, but I'll leave that for any questions that people might have. Thank you for your attention.
Dr. Page, please proceed.
Thank you. After curtailment of face-to-face services to address the pandemic, now our priority is expansion of our in-person services. This will increase the numbers of people entering our clinics. For the safety of the patients and staff, we will continue screening all persons entering each building. Patients who screen positive, including for fever, cough, shortness of breath, or diarrhea, will be referred to a secondary screening area by a registered nurse. This may occur outside in a tent or in a patient's car. The nurse will then consult with the patient's provider to determine what next steps will be taken. Visitors who screen positive will be asked not to enter the building. In addition to increasing our face-to-face clinic appointments in primary care, mental health, and specialty care, we are increasing our procedural specialty appointments, including dental, procedural dermatology, eye clinic, physical medicine, physical therapy, podiatry, and endoscopy. Some procedure appointments, but not all, will require pre-procedure COVID testing. When this testing is required, patients will be notified and scheduled for a pre-procedure COVID test 3 to 5 days prior to their procedure appointment. For the convenience of our patients, we've established COVID testing at all of our clinic sites. This will allow patients who have a procedure appointment at the medical center in West Los Angeles to complete their pre-procedure testing at their local clinic. Santa Barbara, Santa Maria, and San Luis Obispo will continue to expand our VA clinical video telehealth services. This service brings specialty care to our community clinics, so patients can be evaluated for specialty care services, including both general and specialty surgery. Patients can be evaluated for surgery, have their preoperative evaluation at the local site to limit their number of travel days to the West LA Medical Center. If we are unable to meet the needs of a patient due to clinic access or drive time, patients can request to be referred to care in the community in accordance with the precepts of the Mission Act. We recognize that many patients will still want to avoid coming in to see their doctor because of concerns about the COVID-19. So primary care, mental health, and specialty services will continue to have ample home virtual care appointments like VA Video Connect as we increase our face-to-face appointments. To ensure the safety of our patients in the Northern Clinic bus has implemented similar COVID screening as described above. Patients screening positive will not be permitted to ride the bus, but they will instead be referred to their local clinic for further evaluation. All clinics will review our list of patients who might have missed or canceled an appointment during the last 3 months so that we can make sure we provide necessary care that might have been delayed. Regarding our Santa Barbara site, we've had difficulty recruiting new providers over the last several years. We have been able to staff the clinic with traveling providers, including Dr. Gaines, who is a longtime Santa Barbara VA who recently retired, who now works part-time. Our good news is that Dr. Samra was recently hired and is currently working there. Nurse practitioner Marcy Hoppy and Dr. Sylvia Kreminski will be joining her in July and August respectively, so we'll be fully staffed permanently by midsummer. If you are new to the VA and have registered with GLA, you can call 877-252-4866 and tell the operator that you want to sign up for a new provider and the location you wish to go. You will be given the option of vesting with either a new provider in person or virtually using VA Video Teleconnect. Thank you.
Thank you, Dr. Page, for your remarks. This is a lot of important information, and as we move with reopening our communities and working towards economic recovery, we look forward to continuing to hear from all of you. Again, thank you for submitting your questions in advance. As a reminder, you can visit my Facebook page, facebook.com/Rep Salud Carbajal, to submit any additional questions. And now, for tonight's first question, it's a little lengthy, but here I go. And at the end of my reading of this question, any of our veteran panelists are welcome to answer it. I would like to suggest a phone line that goes directly to the Santa Barbara Veterans Medical Clinic for use by the local veterans in Ventura, Santa Barbara, and San Luis Obispo. I received a notice to call a local number to arrange lab and doctor visits, and it goes directly to the Los Angeles VA clinic. Wait time for the 2 calls I made was 18 minutes. I finally gave up and went to the local clinic and was able to make my appointment. Having to call for appointments through LA Clinic is a complete waste of time because of the sheer number of vets using the LA Clinic. Why should I call LA when my appointments are in Santa Barbara Clinic? There was a few other questions like that.
So, Congressman, this is Dr. Braverman, and I'll jump on that for you because we recognize this issue. And when I got here, that was an issue for our whole entire healthcare system, not just the northern clinics, where we weren't doing a good job answering the phones. We've hired additional people. We've put some folks on telework, and we've expanded our capability to manage our centralized call-in system, and that's something that's actually recommended from higher headquarters because of the efficiency of operations. We now, as of last month, are meeting the goals of 30 seconds time to answer and a 5% abandonment rate. First time in years that we've been able to do that. So the one thing I'll ask is that we are able to continue to monitor now the success of people being able to come through our system and get put into contact with the right people to meet their requirements so they don't have to come into a clinic and actually put folks at risk because of this current COVID situation. So I think we're going to do better, but if it doesn't work out in the next 3 months, then we're going to bail out of the VA central office policy and we'll take care of it locally. Over.
Great. Thank you so much for that answer. The next question is, the volunteer coordinator position has been vacant at the Santa Maria VA clinic since last August. Without a volunteer coordinator, no one maintains the vans or organizing the drivers of the vans. This is important to ensure veterans have proper access to VA healthcare. When will this position be filled?
Hello, everyone. This is Prachi Asher. So I recognize the Santa Maria VA Clinic volunteer coordinator was a very difficult position to fill. We had announced multiple times, and we actually had selected candidates, but then they declined for various reasons. But we persisted, and we have made a selection. We found a great candidate, somebody who is from that area and would really like to work for the VA, and they're in the process of being onboarded. We've also gotten a new volunteer services coordinator, Alexia Lunningham. She's been with our organization since August of last year, and she's also very engaged with operations at Santa Maria. So with rebuilding the voluntary services team and getting a person on board at Santa Maria, you'll see a marked improvement in the management of voluntary services at the Santa Maria Clinic. Thank you.
Thank you very much. The next question is, my father is a proud World War II vet. He is 99 years old and lives with the challenges of Alzheimer's disease. I am his caregiver. The VA had been paying for him to attend the Friendship Center in Santa Barbara, California. Due to the pandemic, they have been closed since March. The Friendship Center continues to provide support with a full schedule of virtual activities, monthly tote bags full of snacks, games, etc. They provide weekly teleconference support to groups and have set up home health assistance. They also coordinated a free lunch program for the vets. The entire staff works hard to make sure my dad are okay. I was surprised to find out that the VA has stopped all funding. They are still working hard to care for the vets that attend the Friendship Center. Will the VA restore the funding? Back to you.
Hi, yes, this is Dr. Braverman. This is the first time we're hearing about this particular issue, and the best I can answer today is that we're going to look into it and get back with you and your team with an answer. I don't know what changes have been put in place because of these COVID restrictions and whether there are legal restrictions on what we can pay for virtually versus in person. So we're going to take a look at that after this meeting and get back to you tomorrow. Over.
Thank you so much. The name of that facility is the Friendship Center. The executive director is Heidi. I can't remember her last name, but just wanted to give you that information. Going on to the next question. Why is the VA not allowing COVID-19 serologic antibody testing for veterans who may have had the infection and recovered? This would give higher accuracy of the actual numbers of persons infected and recovered and identify the persons now having naturally acquired immunity, thus avoiding future unwarranted vaccinations.
This is Dr. Getz. It's a very good question, and a question many people are interested in. So the laboratory here at VA Greater Los Angeles has recently brought on board for use a serological test which will allow us to determine whether persons have antibodies. We're still in the process of doing some validation of the test to make sure the laboratory test performs as we would like. We're testing it on populations of patients where we know they've had COVID-19 to make sure we get the expected results. We're also making plans to be able to confirm that when we get a positive result, it really means that the result is positive. As some people may have read, there have been issues that the tests aren't always as precise as we would like them to be in terms of determining whether a person has a false positive test or a true positive test. So we're working on systems so that we can confirm the test is positive and give our patients the accurate information that they deserve. We're also tracking very carefully the scientific literature that allows us to determine what a positive antibody test means when it's positive as to how much protection that may or may not provide. It's a topic of great interest to all of us. It's a topic of interest to our patients, to our staff, and to all the physicians and medical staff of the facility. Thank you.
Hey, this is Dr. Braverman. I just want to jump in with a little extension to that answer. Because I really want to highlight the work that our laboratory has done here through this whole pandemic. Number one is that for the straight up COVID positive or negative, do you have it now, swab test, that's available at all of our clinics for all of our veterans, anybody who has an indication to get tested. The other thing is since the beginning of this pandemic, our lab actually developed its own test and validated that test so that we could get started with the testing before it was widely available in the community. And because of that, we were able to do special screening, surveillance, and containment testing so that we could identify and stop an outbreak of COVID-19 disease in our nursing homes. And then we use that capability to do the testing actually for veterans in community nursing homes, even though they weren't part of our facilities. So that actual article that we then wrote as part of journal articles to tell the world what we were doing because we actually curtailed an outbreak was published in the CDC's Morbidity and Mortality Weekly report, their journal, about 3 weeks ago, and it was nationally recognized. So the team is pretty terrific here, and that's one thing I wanted to highlight. Over.
Thank you. The next question is, I am a volunteer with the Santa Maria CBOT. To be a volunteer, you need a volunteer ID badge. It has been promised that a mobile volunteer badge machine would be available in Santa Maria, and we have now been waiting 2 years. Now we have to drive to Fresno or Los Angeles to get our badges. This makes it difficult to keep volunteers. When will it be available in Santa Maria?
Hello, this is Prachi again. So I'm going to have to do a little bit more research on this issue. Typically, it doesn't take that long. We do have mobile services, maybe not exactly at Santa Maria, but we do try and match up CBOCs that are within a commuting distance of each other, and then propose a date when the mobile PIV badging operation gets up there. But your concern is noted, and we will get this addressed immediately. Thank you.
Thank you. The next question is, I'm a veteran who is not registered with a VA doctor. How do I sign up for an initial exam if I can't go to the clinic in person?
Good evening. If you're new to the VA and you've registered with GLA in the past, you just need to call the call center number 877-252-4866 and tell them that you would like to sign up with a new provider. We can either see you virtually through VA Video Connect, which is an internet program, or an app on your phone, which can be downloaded, or they can be seen in person. If they're not registered with the VA, they can go to the VA clinic and then go to the business office there, and they can establish registration and then set an appointment.
Thank you very much for that answer. Previously, there was a question regarding the Friendship Center. I just wanted to provide the veterans, the VA staff, the name of the executive director. It's Heidi Hawley, and she is the executive director of the Friendship Center. Moving on to the next question. With the changes in the Mission Act that allow veterans to see doctors in the community, many doctors in our rural counties aren't taking any more patients. What is the VA doing to find more medical providers who will accept veterans?
Hi, this is Ashna Basu. I'm from Care in the Community. So we do recognize the need to make our network, expand our network, and have a more robust VA system, as well as expand the community care options for the patients in order to make sure that we have an adequate network of providers. We are frequently meeting with our third-party administrator, which is TriWest, to make sure that we look at the demand as well as the capacity and identify any gaps that exist, specifically in the CBOC areas. So we had January 2020 is when this project started. We had a meeting in Arizona with our TriWest representatives. We started the project called the Demand Capacity Work Group, and we are constantly identifying any gaps that exist near the CBOC, giving that data to our TPA, which is TriWest, our third-party administrator, and then they go on to identify that need and make the effort to sign up with more providers to fill those gaps.
The next question is, some medical providers in our area are reluctant to bill the VA because it takes too long for reimbursement. Is there anything being done to speed up that process?
Hello. In the past, yes, timely payments have been a challenge, but we do have an entire office set up. That's the consolidated accounting group that processes bills. Often, what ends up happening is when there's a struggle to get something paid, it's usually because of a piece of misinformation or something that's incomplete in the community provider's file, which causes a delay, but not always. But we do have lots of steps and individuals to help you through that registration process, including getting bills paid, because VA is held to a metric to getting those paid on time. So if you know of a specific provider who's struggling or perhaps is afraid to engage with the VA because of this reason, please reach out to us. We'll get them in touch with the right group and get them set up. Thank you.
Thank you. The next question is, veterans repeatedly find themselves on the wrong end of collection agencies after an emergency room visit. The usual cause is because the VA has denied payment because the bill was sent to the wrong VA address. What can be done to remedy this situation?
Hello, this is Ashna Basu. I will speak to that again. So the emergency process is undergoing a transition as we speak. GLA was actually one of the 10 pilot sites that went through that process, and the initial notification usually determines how the billing would be done. So we're actively making that outreach to educate the facilities on this new process. All of the billing and the notification will now be centralized. So there will just be one number, and all community facilities will be contacting that number, and that's where the guidance on billing would be coming from. Because there is local billing as well as TriWest is part of that process now. In the past, because of different points of contact and entryways into where the notification comes in, it's understandable that things may have gotten complicated in terms of the guidance, but that is the reason that this whole process is being revamped and centralized in terms of billing and the intake. So we are actively reaching out to these community facilities for education.
Thank you. The next question is, do you have a list of all medical providers in our area on the Central Coast that are signed up with the VA, and is that list available to veterans?
Yes, this is Ashna Basu again. There is a list of all the providers that are signed up with the TriWest network or the Optum healthcare system, depending on where you happen to be. For us, it's TriWest, and it's available on va.gov. The data that's included in that site is periodically tested by TriWest to make sure that it's accurate. So the veterans do have access to that, names of over 200 providers in the community through va.gov.
Okay. So you can just go to va.gov and you would be able to find the TriWest providers then?
Yes, it is in the same location where the urgent care provider list of in-network urgent care providers. I can follow up with you and send you the exact link in case there are other areas that would make it a bit more streamlined.
That would be very helpful. We get a number of questions about that on a regular basis. So
Absolutely.
I would appreciate it. That would be great. Thank you. The next question is, many of the veterans on the Central Coast do not have computers or are familiar with how to navigate the internet. What is being done to provide them with the same services that are provided for internet users?
So the platform the VA is developing is also very usable on a smartphone. So if you download the VA Video Connect app, you can download that and use your smartphone to correspond with your team, your primary care team, using secure messaging, or you can even set up a video visit and do the video visit on the smartphone. If you do not have a smartphone, the VA is starting a program that's happening in the next few months that they'll be giving iPads to people that do not have smartphones, and so they can also connect with their team as well.
Thank you. The COVID-19 situation, vulnerable veterans can't take public transportation without exposing themselves to higher risk to see their VA doctors. What are you doing in the way of home exams or care?
So we've been doing this over the last 3 months, where we've been doing a lot of virtual care modalities where we're taking care of patients using VA Video Connect or other platforms like Skype, where the provider and the nurse are calling the patient using these video modalities and interacting with them to discuss their symptoms and also treat them and order their meds, etc. So we have been able to do a lot of care using these virtual modalities and letting patients stay home. And we plan to continue this.
Thank you. Just for awareness, we have about 6 more questions. There was a few submitted, many of which have been incorporated. So we're going to proceed. The next question is anything being done to improve the number of in-home aides and attendance providers?
This is Dr. Simon, Chief of Staff. As with all of our providers and services required for our network, we are constantly reviewing the needs in all of our communities. We are not aware of any significant concerns of deficiencies in the area of in-home aid and attendance and home care services, but we'll constantly look at that and we'll review it again. And if there's a need, as Dr. Basu had said previously, we'll work through Tri-West and expand our service. We also do have a waiting list of contractor to provide these services. Over.
Thank you. The next question, what plans are there to reach out to homeless vets in Santa Barbara, San Luis Obispo, and Ventura counties to provide them medical care?
This is Mac McHenrick. In each of the areas where we have the CBOTs, which cover the 2 counties, we have partners that we work with in the partner organizations. We have the Santa Barbara and the San Luis Obispo collaborative partners who really are key to keeping up with the homeless population and making sure that we're aware where they're at. We have outreach teams in that area that are made up of peer support and veteran justice individuals who go to the court system and work with the court system with veterans who have legal issues with the court. When we look at the overall services, we have to look at the goal of housing and moving veterans along in their care as well as their housing for the homeless. We have 158 vouchers in use in Santa Barbara County, and San Luis Obispo County we have 172 HUD-VASH vouchers being used. Those are the number of veterans that are in the voucher program that have been moved from homelessness to being housed. So we keep up with those. Each of those has a case manager, and the case manager calls with them. If they need to visit, they check with them to see if they have any of the symptoms for COVID. They arrange for a visit. They do it at a safe distance, wearing face masks and not touching things. And they work through their case of what their issues are. If they're having trouble with any of their medical care or housing assistance or sometimes landlords and rent and other issues. We're waiting for the new numbers to come out for the point-in-time count, the annual point-in-time count. That should be out any week now. We'll see how that looks for last year. And then, of course, when we do this year's count, we'll have the issue of COVID impact to deal with. Thank you.
Thank you. The next question is, over the years, the VA has looked at expanding access to VA community-based clinics on the Central Coast, including urgent care on the Central Coast. Is that still under consideration? And why is there not urgent care in the Santa Barbara area?
So we have, if you're assigned to a PAC team, that is included urgent care. So if you have an urgent issue, you can contact your PAC team either through secure messaging or via the phone to tell them that you need to come in, or you can just walk in if that's the case. And our PAC team, each team will address the needs of the patient. So we do have urgent care per se. The other things that we're looking to expand is our surgical and procedural services. So we hired physician assistants to represent the surgical teams, and using CVT, which is a modality where patients come in and see the PA, and then back here at West LA, the surgeon will join them via teleconference, and they can talk to the patient about an upcoming surgery and describe what is needed to do for their care, and so they can get specialty services at all the sites.
So, Dr. Basu, Dr. Basu, do we have a gap in Mission Act approved urgent care clinics up there?
As far as I'm aware, we had done that analysis specifically for urgent care and resolved it with the help of Tri-West. So if we can look into this around Santa Barbara area and get back to you. Usually, friends or the providers they reach out to us, and we initially, when the Mission Act was rolled out, we frequently heard about the potential gaps, and we have not had any word on it over the past 6 months or so. So would love to hear more details on this, and we can also look into it ourselves and let you know. Thank you.
Okay, and one can go into accesstocare.va.gov, type in a zip code, and it'll identify all of the urgent care locations in the vicinity, depending upon the number of miles you enter for that zip code. Thank you.
Thank you. The next two questions were received recently through the Facebook procedure I outlined earlier. The next question is, I am a retired 36-year Army Lieutenant Colonel and a 100% disabled combat veteran. Could you please tell me why we only have 3 individuals assigned to paying the outside medical bills for the greater Los Angeles area? I wound up in the ER in San Luis Obispo in October 2018. The bill was finally paid this April. I even personally took a copy of the bill to the Sepulveda office, and it still took a year after that, and with continued follow-up. This January, I found myself once again in the ER, and now I am fighting the same issue of my medical bill being paid in a timely fashion. This issue is going to kill the Mission Act unless action is taken to correct these billing problems. None of our local providers are going to participate in the Mission Act. Thank you.
So,
Okay.
this is Asha.
Go ahead, please.
Thank you. This is Ashna Basu again. So it would be great to hear about the details from this veteran because the process of billing and payment, as I had mentioned earlier, all of this is being centralized as we speak. The rollout nationally was June 8th, so just a couple of days ago, all sites underwent this transition where the billing, claim submission, and the payments will be done through the central team. If we can get the details for this veteran, we can look into the specific case and make sure that we make that outreach.
Thank you. If we have that information, we'll certainly get it over to you ASAP. The next question is, I am a veteran with an eye disability that requires to see an ophthalmologist and seem to have difficulty every year making appointments locally because the rules seem to change every year without notifying me of the current requirements to make the appointment. I was called last week by a VA person who took questions and said he was going to call me back in 20 minutes. I haven't heard from him since. He said that Tri-West is no longer doing appointments and the VA has taken over that job, but doesn't seem that it has gone any better. How do I stay on top of this since I live 60 miles from the Santa Maria Clinic with any eye care? Thank you for your attention to this.
This is Ashna Basu. So the transition to take on scheduling from Tri-West within the internal VA team is happening starting this week. So June 1st was our go-live date. And I know that our staff here are undergoing training, and we're also adding additional staff and training them with the internal scheduling process. So once again, if we can get some more information from about the veteran, we can make the outreach. But fortunately, in these cases, we have the consult as the trigger. So we make sure that every consult is getting a follow-up in less than 7 days. So we will make sure to review all the consults and ensure you that we can follow up and get the appointments done correctly and timely. I think it's because of the transition that's happening this week and the time that's being spent on training. I am not going to say that there is no delay, and I'm pretty sure that this veteran has a good case and we can make sure to get back to them.
Thank you so much. Another question that came in through the Facebook portal. Why are veterans who go to the vet centers not allowed to use the VA shuttle vans to get to their appointments? The vet centers are part of the VA. Veterans in rural areas are not able to make their mental health appointments due to transportation.
So unfortunately, vet centers are actually not part of our healthcare system. That's a separate entity, and they have their own transportation system. But the transportation for healthcare appointments, as far as the benefit of what's available to veterans, applies only to our healthcare system and not to the vet centers.
Thank you. This will be the last question. Has there been any discussion about the VHA rearranging the VISN boundaries in California because of the expanding population?
No, there's no discussion in regards to that. Each of our hospital systems within the Visn monitors the needs of what services we can provide based on any kind of expansion of veteran populations in each of our catchment areas. So there's no need to do anything in regards to rearranging the Visn. We have 8 hospitals within our Visn, 4 of them in California, ranging from here in our catchment area down to San Diego, and then 3 in Arizona and 1 in New Mexico. Over.
Could you go over what the VHA stands for and the VISN boundaries, what those acronyms stand for, so that the general veteran population knows what they are?
Yes, thank you. So the Department of Veterans Affairs is divided into 3 administrations. One, the Veterans Health Administration. That's what VHA is. That's all of the health care that we do within the VA. There's the Veterans Benefits Administration, which is the organization that takes care of compensation and pension exams, GI Bill, education benefits, home loans, that kind of thing. And then the National Cemetery Administration, which takes care of burials and all of the benefits associated with that. Within the VHA, the Veterans Health Administration, the country is divided into 18 different networks called the Veterans Integrated Service Network. That's what VISN stands for. And even though I said 18, we're VISN number 22 because there used to be 23 networks, and many of them have been readjusted just about 4 years ago. So there was a rearranging at that time, and that's how we ended up with the 8 in our network called the Desert Pacific Desert Network. So, and that's Loma Linda, Los Angeles, Long Beach, San Diego, Tucson, Phoenix, Prescott, Arizona, and Albuquerque, New Mexico.
Thank you. Well, with that, I want to thank you all for joining us tonight on this Tele-Town Hall meeting. And I also want to give a special thank you to Dr. Braverman, Dr. Getz, and Dr. Page, and all of the VA staff that are on this call as a resource tonight. For shedding light on the VA healthcare system, the questions that many of our veterans have had and posed, and the response of the VA healthcare system to addressing the needs of our veterans throughout the COVID-19 crisis. Again, please don't hesitate to contact my office should you require assistance with the VA and other federal issues. My district office can be reached by calling 805-730-1710 or by sending me an email at carbajal.house.gov. Thank you again to everyone and to our guests from the VA. Stay safe and healthy. Have a good night.